Study section 14. Assessment needs and care during pregnancy. Introduction. In the previous study section, you have learned about these psychosocial changes in pregnancy, diagnosis of pregnancy, objectives of prenatal care, and process of prenatal care. In this study section, we'll be discussing the expectant mother's general physical examination, abdominal examination, and how pelvic assessment is conducted. Learning outcomes. At the end of this study section, you should be able to explain the general physical examination of the woman prenatally and how to conduct examinations. General physical examination during pregnancy. This involves a head-to-toe physical observation. The head is examined for lice and dandruff. This could result in anemia and disturbed sleep. The conjunctival and the lips are observed for paleness. If the nose is discharging, this will indicate upper respiratory tract infection. The tongue for glossitis and dental caries is also identified if any. The fingernails are also examined for pallor. Height of over 160 cm is indication of normal size pelvics. Conversely, abnormally short stature may indicate contracted pelvics. Weight should always be measured during the same scales, and the woman asked to wear similar clothing each time she is weighed. Obesity could be associated with gestational diabetes and pregnancy-induced hypertension, PIH. Blood pressure. Blood pressure is monitored in order to ascertain normality and provide a baseline reading for comparison throughout pregnancy. She should always be in the same position to ensure a comparable reading. An adequate blood pressure is required to maintain placenta perfusion, but systolic blood pressure of 140 mmHg or diastolic pressure of 90 mmHg at booking is indicative of hypertension and could cause damage to the placenta. Factors that increase accuracy of blood pressure measurement and recording. Irregular cervix mercury column. Sphygmomanometer should be used. The correct weight of cuffs should be chosen for the woman. Initial estimation of the systolic pressure should be by palpation. Blood pressure should be recorded to the nearest mmHg. Urinalysis. Urinalysis is performed to exclude abnormality like asymptomatic bacillary. Take 2. Like asymptomatic bacillary. Ketones due to increased maternal metabolism caused by fetal need or because of vomiting. Glucose caused by higher circulating blood levels, reduced renal threshold or disease. Protein due to contamination by vaginal lacorial or disease such as urinary tract infection, UTI or PIH. Abdominal examination. This includes inspection, palpation, and auscultation. A. Inspection. Inspect the abdomen for size, scar, striae gravidarum, and linea nigra. The shape, whether it is oval, globular, or pendulous. B. Palpation. Includes further lateral and pelvic palpations to determine the height of fundus, fonder presentation, and engagement of the presenting part. Palpate as follows. A. Further palpation. To find out what is in top of the uterus, face the woman's head. Put your hands on both sides of the top of the uterus and curve your finger around. Palpate for shape, size, firmness, and how easily the baby moves. If the fetal head is in the top of the uterus, you will feel a round and hard part which is movable. If the buttocks are felt, they will be irregular, bulky, and softer than the head, and the top of the uterus will feel full and not easily moved. If there is a transverse lie, the fundus will feel empty. Lateral palpation. Continue to face the woman's head. Place both hands further down on the abdomen. Push down with one hand, pushing the fetus to the other side of the abdomen. Feel the fetus so that you can tell the parts. Gently move the baby from side to side to more easily tell which side has the buttocks and which side has the arms and legs. C. Auscultation. Listen to the fetal heart rate. Normal rate is between 120 to 160 beats per minute. If the heart rate is above 160 or below 120 beats per minute, the baby may be having problems. Aims abdominal examination. The aims of abdominal examination are as follows. 1. To observe signs of pregnancy. 2. To assess fetal size and growth. 3. To assess fetal health. 4. To diagnose lactation of fetal parts. 5. To detect any deviation from normal. Pelvic assessment. Continue to face the woman's head. Have the woman bend her knees. Grasp the part of the baby in the lower part of the abdomen. Ask yourself, what is in the lower part of the abdomen? Compare to your findings of the first palpation. Turn and face the woman's feet. Make sure that the woman's knees are bent. Place both hands on the side of the abdomen and press them towards the pelvis. Compare the findings of the other palpation and figure out the presentation. Check if you feel more than one baby. Locating landmarks for descent. Landmarks used in measuring the descent are the fetal head and the maternal pelvic brim. Procedure. A. Stand at the side of the woman. If you're right-handed, stand at the woman's right side. B. Feel the head with your right hand. The head can be moved. When all of the head is felt, it is measured as 5 feet above the brim, i.e., 5 of your fingers can cover the head above the brim. C. When the baby's head is 4 feet above the brim, 4 of your fingers can cover the head above the brim. It is just entering the brim. D. When it is 3/5, 3 of your fingers can still go partially round the head. E. When it is 2 feet above the brim, only 2 fingers measured the head because more than half of the head has entered the brim. You can no longer feel the roundness of the head. F. The head is now engaged. It is almost impossible to move the head. G. When the head is all the way in the pelvis, you cannot feel it abdominally. Study section summary. In this study section, you have learned that 1. General physical examination involves observing the expectant mother's state of health physically and taking note of any deviation from normal. 2. Abdominal examinations is conducted to observe signs of pregnancy, assess fetal growth, and to detect any abnormality. 3. Pelvic palpation is used to judge the size, flexion, and mobility of the head, determine position in a vestal's presentation. End of study section 14. Thanks for listening.